Your body doesn't shout when something's wrong, it whispers. A small ache, a bit more tired than usual, forgetting where you put your keys. These tiny changes may seem harmless, but sometimes they're your body's quiet cry for help. The truth is, many serious health issues start with subtle signs we brush off as just getting older. But what if those whispers are early warnings, chances to act before things get worse? Today, we'll uncover 15 silent signs your body is in trouble, and what each one could mean for your long-term health. So, if you've noticed your body feeling off lately, stay right here, because one of these could save you months, or even years, of future health struggles. Before we continue, kindly tap the subscribe button on your screen, because every week on seniorFood and Wellness, we share practical, science-backed tips to help you live stronger, longer, and with more peace of mind. Welcome to seniorFood and Wellness, the channel where we help you understand what your body is really saying, so you can make simple, smart choices that add vitality to your days. Whether you're in your 50s, 60s, or beyond, this is your space for real, reliable health insights made easy to follow. Today, we're diving into a topic that matters to every one of us: the subtle warning signs your body gives long before serious health issues appear. You see, as we age, our bodies become quieter but wiser. They often try to warn us gently, through fatigue, bloating, swelling, changes in skin, nails, or sleep, before louder symptoms ever appear. Unfortunately, most people ignore these early signs until they turn into something that requires medication, or worse, hospitalization. But not you, not anymore. By learning to recognize these 15 silent signals, you can take control early, protect your energy, and support your body the way it deserves. Each sign we'll discuss has a real cause behind it, from vitamin deficiencies to circulatory issues to hormonal shifts, and I'll explain each one in simple, practical language you can act on right away. No jargon, no scare tactics, just clear, honest advice you can trust. Stick with me until the end, because we'll also cover what to do if you notice one or more of these symptoms, when to get checked, and how to strengthen your body naturally using food, movement, and a few daily habits. You'll also learn the single most overlooked health pattern that could quietly drain your strength without you realizing it. So take a deep breath, get comfortable, and let's start listening to what your body's been trying to tell you. Because the sooner you pay attention, the sooner you can take back control of your health, one small sign at a time. Sign 1. Constant fatigue, not just getting older. Feeling tired once in a while is normal. But when exhaustion becomes your new normal, that's your body waving a quiet red flag. Many seniors brush it off, saying, "I'm just slowing down," or, "That's what getting older feels like." But here's the truth: chronic fatigue is not a natural part of aging. It's your body's way of saying something isn't right. When you wake up still tired after a full night's rest, or if even simple activities, like grocery shopping, gardening, or walking to the mailbox, suddenly feel like a workout, it's time to listen carefully. This kind of fatigue can stem from low iron or vitamin B12, thyroid imbalances, or even dehydration, all of which are common as we age. The tricky part is, these issues creep up slowly, so the change feels gradual, not alarming. But the body notices. Iron and B12 deficiencies affect how your blood carries oxygen. Without enough, your muscles and brain don't get the energy they need. Likewise, when your thyroid slows down, a condition called hypothyroidism, your metabolism drops, making you feel sluggish no matter how much you rest. Certain medications, especially for blood pressure or mood, can also drain your energy. So what can you do? Start simple. Track your tiredness. Notice when it's worst, morning, midday, or evening. Drink water more often, and make sure your meals include real sources of protein, leafy greens, and whole grains. Ask your doctor about testing your iron, B12, and thyroid levels. These are simple blood tests that can reveal a lot. Most importantly, don't let anyone dismiss your fatigue as just age. With the right nutrients, hydration, and small daily movement, your energy can return. Remember, your body isn't asking for more sleep, it's asking for balance. So, before you grab another cup of coffee, pause and listen to what your tiredness is really trying to tell you. Because sometimes, fatigue isn't a sign of aging, it's your body's first quiet request for care. Sign 2. Frequent muscle cramps. What your body's missing. You're lying in bed or sitting comfortably when suddenly that sharp, tightening pain hits your leg or foot. A muscle cramp. It's quick, intense, and leaves you wondering what just happened. Many seniors experience this daily and shrug it off as part of aging. But here's the truth, frequent muscle cramps aren't just a nuisance, they're a signal your body is missing something important. Muscles don't cramp without reason. They rely on a perfect balance of minerals and fluids, especially magnesium, potassium, calcium, and sodium, to contract and relax smoothly. When these minerals fall out of balance, the nerves misfire and the muscle locks up painfully. As we age, our bodies lose electrolytes faster, and medications like diuretics, for blood pressure, can flush these minerals out even more quickly. That's why older adults often experience cramps at night or after light activity. But hydration plays a huge role too. By the time you feel thirsty, you're already mildly dehydrated, and your muscles feel it first. Even small fluid loss affects how muscles perform, leading to tightness, twitching, or full-on cramps. Low physical activity, sitting too long, or sleeping in one position can also slow circulation, making cramps more likely. The fix doesn't require anything extreme. Start with steady hydration. Sip water throughout the day instead of gulping it all at once. Include foods rich in electrolytes. Bananas, spinach, avocados, and yogurt are excellent choices. A small pinch of sea salt in water or electrolyte drinks, with low sugar, can also help, especially in warmer weather. If you take medication that affects fluid balance, ask your doctor about safe supplementation. And don't forget gentle stretching. Flex your feet, roll your ankles, or massage the muscles before bed. It keeps circulation active and reduces nighttime cramps. Remember, your muscles aren't rebelling, they're communicating. Each cramp is your body's way of saying, I need balance. When you listen and respond, you'll not only ease the pain, you'll give your body exactly what it's been asking for all along: proper nourishment and care. Sign 3. Sudden weight loss. When shedding pounds isn't a good sign. For most of our lives, we're told that losing weight is healthy. But what if the weight starts slipping away without trying? You haven't changed your diet, you're not exercising more, yet the number on the scale keeps dropping. This isn't a victory, it's a message. Unexplained weight loss is one of the body's clearest warnings that something deeper may be wrong. In older adults, losing more than 5% of your body weight within a month or two should never be ignored. It might be related to changes in metabolism, but more often it signals an underlying issue, like an overactive thyroid, digestive disorders, diabetes, or even muscle loss from poor nutrition. Sometimes, emotional stress or depression can also cause the body to burn through energy faster, leading to unintentional weight loss. As we age, our sense of taste and appetite often fade, and chewing or digestion can become harder. This means we may eat less without realizing we're not getting enough calories or protein to maintain muscle mass. Over time, that leads to fatigue, weakness, and increased risk of falls, all from simple nutrient gaps. The good news? You can reverse it. Start by keeping track of your meals and weight weekly. Focus on nutrient-dense foods, eggs, beans, healthy fats like olive oil or avocado, and plenty of colorful vegetables. Don't skip meals. Instead, eat smaller portions more often. If food feels bland, use natural herbs and spices to boost flavor. And always mention sudden changes in appetite or weight to your healthcare provider. A few simple tests can rule out serious causes and help you regain balance. Remember, weight stability is strength. When your body changes without your permission, it's time to pause and listen, because your health may depend on catching it early. Before we move on, kindly tap the subscribe button on your screen. At seniorFood and Wellness, we share weekly, science-based tips to help you understand your body, strengthen your energy, and age with confidence and control. Sign 4. Persistent bloating, when just gas might mean more. Everyone feels bloated now and then, after a big meal, too much salt, or fizzy drinks. But when that uncomfortable fullness becomes a regular part of your day, it's more than just gas. Persistent bloating is one of the most overlooked signs that your digestive system is struggling, and in seniors, it's especially common because the body's ability to break down food naturally slows with age. As we get older, the stomach produces fewer digestive enzymes and less stomach acid, which are essential for breaking down proteins, fats, and carbs. Without enough of them, food lingers longer in the gut, leading to pressure, gas, and discomfort. Many seniors also become more sensitive to certain foods, like dairy, gluten, or high-fat meals, even if they never had issues before. That's because the digestive lining becomes thinner and less resilient over time. Medications, especially antibiotics or acid reducers, can also disrupt the balance of good bacteria in the intestines. This imbalance, known as dysbiosis, can trigger bloating, irregular bowel movements, and even inflammation. But the good news is that your gut can often bounce back with a few mindful adjustments. Start by keeping a simple food diary. Note when bloating happens and what you ate beforehand. Patterns often reveal hidden triggers. Eat smaller meals, chew slowly, and avoid lying down right after eating. Incorporate natural digestive aids like ginger or peppermint tea, and consider probiotic-rich foods such as yogurt or kefir to restore healthy gut bacteria. And if you notice constant bloating along with pain, nausea, or changes in bowel habits, talk to your doctor. It could be a sign of a food intolerance, gallbladder issue, or another digestive condition that needs attention. Remember, bloating is your body's way of saying something isn't sitting right. You don't have to live with that discomfort every day. Understanding the cause is the first step toward relief and better digestion. Before we continue, kindly tap the subscribe button on your screen. Here at seniorFood and Wellness, we're helping you listen to your body's signals and turn small daily choices into lifelong wellness. Sign 5. Changes in handwriting or coordination. What your nerves might be telling you. Have you noticed your handwriting getting smaller, shakier, or less steady? Maybe buttoning your shirt or holding a spoon feels trickier than it used to. These small changes often sneak up so gradually that they're easy to brush off, but they can be powerful clues about your nervous system and muscle control. Your brain, nerves, and muscles work together like an orchestra. When one instrument starts to fall out of tune, the coordination you once had can weaken. Subtle changes in handwriting, tremors, or slower movement can signal early issues with nerve health, muscle strength, or even brain function. For example, conditions like Parkinson's disease, peripheral neuropathy, or early neurological shifts can begin with something as simple as a softer grip or a less steady hand. But not every change is a sign of disease. Sometimes, it's caused by medication side effects, low vitamin B12, or even joint stiffness from arthritis. Dehydration, stress, and fatigue can also make your hands shake more than usual. The key is pattern. If these changes persist or get worse over time, it's worth having them checked. One simple test: write your name on paper. Compare it to an old note from a few years ago. Is it smaller, more cramped, or less fluid? That difference can tell you a lot about what's happening inside. Also, notice whether your movements feel slower or your balance seems off. Your body could be signaling reduced nerve conduction or muscle strength. What helps? Regular movement, light hand exercises, and foods rich in B vitamins and omega-3s, such as fish, eggs, and leafy greens, support nerve health. Stay hydrated and keep blood sugar balanced, since both dehydration and glucose swings affect fine motor control. Most importantly, don't ignore subtle coordination changes. They're not just aging signs. They're your nervous system's way of saying, "I need attention." Listening early gives you the best chance to protect your independence, confidence, and quality of life for years to come. Sign 6. Shortness of breath. When simple tasks leave you winded. You take a short walk, climb a few steps, or carry groceries, and suddenly you're out of breath. You pause, catch your breath, and think, maybe I'm just out of shape. But when breathlessness happens during everyday activities, it's often more than just a fitness issue. It's your body asking you to slow down and pay attention. As we age, the lungs naturally lose some elasticity, and the muscles that help us breathe weaken slightly. But when even light activity leaves you winded, it could be a sign of reduced heart or lung efficiency, anemia, or even fluid buildup in the lungs or around the heart. These issues are more common than you might think, and they tend to creep in gradually. Heart-related shortness of breath usually comes with other subtle clues: swelling in the ankles, waking up breathless at night, or feeling unusually tired after minor exertion. Lung-related causes, like COPD, asthma, or infections, might bring along a mild cough or wheezing. Low iron or thyroid problems can also reduce oxygen delivery to the body, leading to the same breathless feeling. What matters most is when it happens. If you feel winded after rest or with minimal movement, or if it worsens suddenly, don't ignore it. That's the moment to talk to your doctor and ask for a simple heart and lung checkup, including oxygen levels and blood tests. These can quickly uncover what's behind your symptoms. You can support your breathing by practicing gentle activities like walking, stretching, or even deep breathing exercises that expand lung capacity. Stay hydrated, sit up straight to give your lungs room to expand, and avoid smoking or environments with poor air quality. Remember, breathing should feel natural and effortless. When it doesn't, your body is telling you something important. Don't chalk it up to just aging. Listen early, act early, because every easy breath you reclaim is a step toward more energy, freedom, and peace of mind. Sign 7. Persistent dry mouth. The hidden warning you might be ignoring. You wake up with a sticky, dry feeling in your mouth. You sip water all day, but the dryness never seems to fade. Maybe you blame it on not drinking enough. Yet the truth is, persistent dry mouth isn't always about thirst. It's your body's quiet way of signaling that something deeper may be going on. Saliva does more than keep your mouth comfortable. It helps you swallow, digest food, protect your teeth, and fight off bacteria. When saliva production slows, the mouth becomes vulnerable, leading to bad breath, sore gums, cracked lips, and even tooth decay. For seniors, this problem is common because of medications. Over 400 prescription drugs, including those for blood pressure, allergies, anxiety, and pain, can reduce saliva flow. But dry mouth can also point to dehydration, uncontrolled diabetes, or autoimmune conditions like Sjogren's syndrome, where the body attacks its own moisture-producing glands. Even breathing through the mouth while sleeping can worsen dryness, especially if nasal passages are blocked or dentures fit poorly. If you're constantly reaching for water, try small, consistent sips instead of large gulps. Avoid caffeine, alcohol, and tobacco. They dry the mouth even more. Chewing sugar-free gum or sucking on xylitol lozenges can help trigger natural saliva flow. Adding more moisture-rich foods like cucumbers, soups, or melon can make a noticeable difference too. And here's something many people overlook. A dry mouth can change how food tastes, reducing appetite and, over time, leading to poor nutrition. So, it's not just about comfort, it's about your overall health. If the problem persists, talk to your doctor or dentist. A medication review or simple saliva test can often uncover the cause and point to effective treatments. Your mouth may be small, but it tells a big story about your body's balance. Listen when it feels dry, because sometimes that dryness is the body's way of whispering, "I need a little extra care." Sign 8. Unexplained bruising. When your skin speaks for your blood. You notice a dark purple mark on your arm or leg and can't remember bumping into anything. Maybe it happens often, a small bruise here, a larger one there, and you tell yourself, "My skin's just getting thinner." While it's true that the skin and blood vessels become more fragile with age, frequent or unexplained bruising is your body's quiet signal that something deeper could be affecting your circulation, nutrition, or blood health. As we grow older, the fat layer beneath our skin, the one that cushions blood vessels from everyday bumps, becomes thinner. This means even mild contact can cause a vessel to break and form a bruise. However, when bruises appear too easily, or in unusual places like the back, abdomen, or without any recollection of impact, it's time to pay closer attention. Several factors can contribute to this. One common reason is vitamin deficiency, especially vitamins C and K, which are crucial for blood vessel strength and clotting. Without enough of them, even tiny capillaries under the skin can rupture easily. Low platelet counts, liver issues, or blood-thinning medications such as aspirin, warfarin, or certain herbal supplements can also increase the risk of bruising. The good news is that small changes often help. Start by including foods rich in vitamins C and K, leafy greens, citrus fruits, broccoli, and bell peppers are excellent choices. Protein is also key. Collagen found in meats, beans, and bone broth helps rebuild the skin's support structure. Staying hydrated and avoiding smoking can further protect your blood vessels from damage. But sometimes, bruising can be a sign of something more serious, such as anemia, clotting disorders, or side effects from new medications. If bruises seem to appear overnight, take longer than usual to fade, or are accompanied by fatigue or unusual bleeding, like from gums or nose, it's important to get checked by a doctor. A simple blood test can often identify the cause and guide safe treatment. Remember, bruises are like small stories your body writes on your skin, each one revealing what's happening underneath. While most are harmless, recurrent or severe bruising is your body's way of whispering, "Pay attention to me." So, don't dismiss those purple patches as just aging. They're not cosmetic, they're communication. By noticing patterns and nourishing your body from within, you're not just protecting your skin, you're safeguarding your overall health and vitality. Sign 9. Changes in nail color or texture. What your nails reveal about your health. You glance down at your hands and notice something different. Maybe your nails look paler, ridged, or yellowed. It might seem cosmetic, but here's the truth. Your nails are tiny health reporters, revealing what's happening inside your body long before other symptoms appear. Healthy nails should have a smooth surface and a light pink color. When they start to change, in color, shape, or strength, it's often your body's way of signaling nutrient deficiencies, circulation issues, or even underlying medical conditions. Pale or white nails can be a sign of low iron or anemia, meaning your blood isn't carrying enough oxygen. Bluish nails may indicate poor circulation or heart and lung issues, where oxygen levels drop. Yellow nails are often linked to fungal infections but can also point to liver problems or chronic respiratory conditions. Vertical ridges are common with age, but if they deepen or become brittle, it might reflect dehydration or a lack of nutrients like biotin, zinc, or protein. Even your cuticles and nail beds tell a story. Dry, peeling cuticles can suggest dehydration or thyroid imbalance. Thickened or spoon-shaped nails, where the center dips inward, could mean an iron deficiency that's gone unnoticed for months. The good news is that nails respond well to care. Start with your diet. Include foods rich in protein, iron, and vitamins A, C, and E, like eggs, leafy greens, and citrus fruits. Keep your hands moisturized, avoid harsh chemicals, and protect your nails from repeated trauma like tapping or picking. If you notice sudden or extreme changes in color or thickness, don't ignore them. Your doctor can check for anemia, thyroid issues, or infections with simple tests. Think of your nails as nature's health journal, quiet but honest. When they change, it's not vanity, it's valuable feedback. Listen early, act early, and your nails, and your whole body, will thank you for it. Sign 13. Frequent nighttime urination. What it's really telling you. It's 2 a.m., then 4 a.m., and again at dawn, you find yourself getting up to use the bathroom. A restless night like this might seem harmless, but when it happens regularly, frequent nighttime urination, or nocturia, is your body's subtle message that something needs attention. Waking once a night to urinate is common, especially with age. But 2 or more times per night, every night, can signal deeper imbalances. One major cause is fluid retention during the day. When you sit or stand for long hours, fluid pools in your legs and ankles. When you lie down to sleep, that fluid redistributes into your bloodstream and is filtered out by the kidneys, making you need to go more often. However, it can also point to underlying health conditions. For men, it's often linked to an enlarged prostate, which presses on the bladder and reduces its capacity. For both men and women, uncontrolled blood sugar levels, as seen in prediabetes or diabetes, cause the kidneys to work overtime, pulling more water out of the body. Heart or kidney function changes can also make the body release extra fluid at night. You can ease nighttime trips by making small adjustments. Limit fluids 2 to 3 hours before bed, especially caffeine or alcohol, which increase urine production. Elevate your legs for 30 minutes in the evening to help move daytime fluid back into circulation. Keep track of how many times you wake up and whether you feel overly thirsty or notice swelling. These details help your doctor pinpoint the cause. If nighttime urination is sudden, accompanied by pain, blood in urine, or fatigue, seek medical advice promptly. Sometimes, what feels like a minor inconvenience is actually the first sign of something that can be treated early and effectively. Your bladder might seem like it's waking you up, but really, it's your body's gentle way of saying, something's changing, please pay attention. When you listen, you not only protect your sleep, you safeguard your heart, kidneys, and long-term vitality. Sign 14, slow healing wounds. What your skin reveals about your circulation. You get a small cut or scrape, something that used to heal in a few days, but now it lingers for weeks, red and tender. It might seem like a simple nuisance, yet slow healing wounds are your body's warning sign that its repair system isn't working as efficiently as it should. Healthy skin heals quickly because blood brings oxygen, nutrients, and immune cells to the injury site. But as we age, circulation naturally slows, and if blood flow is compromised by diabetes, heart disease, or poor vascular health, wounds take longer to close. High blood sugar, in particular, damages small blood vessels, reducing oxygen delivery and weakening the immune response. That's why people with diabetes often notice stubborn sores on their legs or feet. Poor nutrition also plays a role. Your body needs protein, vitamin C, zinc, and collagen to rebuild tissue. Without these, new skin forms slowly and scars more easily. Smoking, dehydration, and some medications can make healing even slower by restricting blood flow or reducing the body's ability to fight infection. To support faster recovery, focus on circulation first. Move regularly, elevate your legs when resting, and avoid sitting for long periods. Eat a balanced diet rich in lean proteins, citrus fruits, and leafy greens. Keep wounds clean and covered to prevent infection, and never ignore even a small sore that doesn't improve within 2 weeks, especially on your feet or lower legs. If you notice redness spreading, swelling, or unusual discharge, see your healthcare provider promptly. Sometimes, what appears to be a slow-healing wound is actually a sign of underlying vascular disease or immune dysfunction that needs professional care. Remember, your skin reflects your internal health. When it heals slowly, it's not just a surface issue, it's a mirror showing how well your heart, blood, and nutrients are working together. Listen to it, nurture it, and your body will repay you with strength and resilience. Sign 15, constant fatigue. When tiredness isn't just from aging. You wake up tired, drag through the day, and by evening, you're too exhausted to do the things you enjoy. You tell yourself, I'm just getting older. But here's the truth. Constant fatigue is not a normal part of aging. It's one of the body's most overlooked distress signals, quietly pointing toward deeper imbalances that deserve attention. True fatigue goes beyond simple tiredness. It doesn't improve with rest, and it affects focus, motivation, and mood. For many older adults, the causes are multifactorial, a combination of nutritional deficiencies, hormonal shifts, sleep disruption, and hidden medical conditions. One common culprit is low iron or vitamin B12, both of which are essential for carrying oxygen and producing energy in your cells. When levels drop, even small tasks feel overwhelming. Thyroid disorders are another key factor. An underactive thyroid can slow metabolism, leading to sluggishness, weight changes, and mental fog. Meanwhile, chronic inflammation, dehydration, or poor blood sugar balance can leave your body working overtime just to maintain stability. Emotional health matters, too. Anxiety, loneliness, and depression often manifest as physical exhaustion. The path to renewed energy starts with curiosity, not self-blame. Ask, am I sleeping well? Eating balanced meals? Drinking enough water? A daily walk, even for 10 minutes, boosts circulation and oxygen flow to your muscles and brain. Consistent sleep routines and sunlight exposure help regulate hormones like cortisol and melatonin, nature's built-in energy system. If fatigue persists for weeks, it's time for a full checkup. Simple blood tests can reveal thyroid issues, anemia, vitamin deficiencies, or early signs of chronic illness. Most causes are treatable once identified, and restoring your vitality can transform every part of your life. Remember, feeling tired all the time isn't weakness, it's communication. Your body is whispering, I need help. When you listen and respond with care, movement, nutrition, rest, and medical guidance, that quiet whisper turns into renewed strength and energy for the life you still have to live. You've just discovered 15 quiet ways your body asks for help, from fatigue and forgetfulness to swollen ankles and slow-healing wounds. These aren't random inconveniences, they're messages from within, gentle warnings that something may be off balance. The truth is, your body always speaks, sometimes in whispers, sometimes in shouts, and learning to listen early can prevent far bigger problems down the road. As we age, changes in circulation, hormones, and metabolism can mask the signs of deeper issues. But small signals, like pale nails, dry skin, frequent urination, or constant tiredness, often hold the clues to protecting your long-term health. Recognizing them doesn't mean living in fear, it means living with awareness and empowerment. Let's recap the key lessons. Pay attention early. Small, persistent changes matter. Your body rarely sends false alarms. Fuel your health. Balanced nutrition, hydration, and movement are the foundation of every healing process. Rest and recover. Sleep isn't a luxury, it's your body's repair time. Stay curious. Don't accept just aging as an explanation. Ask questions, track symptoms, and get regular checkups. Seek connection. Emotional well-being directly impacts your physical vitality. Laughter, conversation, and purpose all heal more than medicine alone. Your body has carried you through decades of living. It deserves to be heard, respected, and cared for. By noticing these subtle signs and acting early, you give yourself the best chance to age with strength, clarity, and energy. So, take a moment to reflect. Which of these signs resonated with you the most? Maybe it's time to schedule that checkup, add those extra greens to your plate, or simply rest without guilt. Every small step toward awareness is a victory for your future self. Before you go, kindly tap the subscribe button and join our Senior Food and Wellness family, where we help you live longer, stronger, and happier with every video. Share your experiences in the comments below. Your story could help someone else listen to their own body's whispers. Thank you for spending this time with us here at Senior Food and Wellness. You've just taken an important step toward understanding your body's hidden language, those subtle signals that can protect your health and add years of strength, energy, and joy to your life. Remember, every ache, every change, every little whisper is your body's way of saying, "I'm still fighting for you, please listen." Now, here's the truth. Awareness is only the beginning. The next step is action. Start with one small change today, whether that's drinking more water, getting a good night's sleep, adding more greens and protein to your meals, or simply taking a short walk to boost circulation. Over time, these small habits build a foundation of vitality that medicine alone can't provide. If this video resonated with you, imagine how many others could benefit too. So before you go, kindly tap the subscribe button and turn on the notification bell. That way, you'll never miss a single episode packed with tips designed especially for you. In our next video, we'll dive into 10 everyday foods that can quietly damage your heart after 60. You'll be surprised by some of the common items hiding in your pantry right now that may be affecting your circulation, blood pressure, and overall energy. Trust me, you won't want to miss it. And don't forget to share your experience in the comments below. Which of the 15 silent signs surprised you the most? Have you noticed any of these changes in your own body? Your stories don't just inspire us, they guide others who may be silently struggling too. At Senior Food and Wellness, we believe that knowledge is power, but shared knowledge is healing. So share this video with a friend or loved one. You never know whose life it might improve. Until next time, take care of yourself, listen to your body, and remember, aging isn't about slowing down, it's about living smarter, stronger, and with purpose. I'm Dr. Prudence, host from Senior Food and Wellness, thanking you for watching. Stay healthy, stay kind, and I'll see you in the next one.